So, hi everybody, and welcome to Unbox Learning with Surbhi. I am pleased and really very pleased to have my second very special guest on my chat today. My childhood friend, rather, I would say my childhood best friend, and continues to be one of the closest friend I have till date. I am pleased to welcome on my channel Ishita Roy Chaudhary, who is a clinical psychologist. Ishita, I welcome you, and I am really glad that you could spare some time and we could make this video. And this is the time of festival, and sparing your valuable time to sit and discuss about issues that probably people are uh, kind of aware, but they still don't want to kind of talk about it. So Ishita, why don't you introduce yourself to all my viewers, whoever is seeing it.
First of all, thank you for having me. I think it's a great idea that we can talk about certain things which are very essential in the current situation. Like Suvi said, we've known each other for a very long time. So
Yes.
I am basically a clinical psychologist. I'm a practicing therapist. I work in a clinic called Minds Matter, which is in Gurgaon. And I'm an RCI licensed therapist. So I have MA, MPhil degree, which gives me a license to practice. And I've been practicing for about 2 years now. And
Wow.
yeah, so my main areas, I work a lot with adult patients, but I've done during my training, have worked with children. So I do have awareness of things. So we're trained overall. So it's a
I
complicated.
think I think I think this is a time when adults are pretty much feeling like kids. You'll agree upon that. They are not able to they are not able to take instructions that are given by the concerned authorities. Medical advisories are not taken into account. So children and I feel adults are on the same page these days.
Absolutely. I think it's a very uncertain time. It's a very new situation for everybody. So nobody's prepared. Nobody knows what's the right
Exactly.
thing to do. So everyone is at a loss and everyone is trying to just cope with it single day.
Exactly. It's like a strange situation, and I think this strange situation has brought you and I together. We are talking about it. I think
Yeah.
there are a lot of people out there who are talking it out, and I think that's the best therapy.
Absolutely. The fact that people are becoming aware of what is happening is, I think, one of the good things that's come out of this whole
But I
pandemic.
think I think I'm a mom myself, and I have a toddler. She's 2.5 now. Will turn 3 in the month of March. You
Yes,
are yet to see her
yes.
when she's
To
up. I
see them.
will try to pull her in. Okay. So I also have a lot of queries, and I think the queries that a lot of parents have
Hmm.
sent to me, and while I was talking to a lot of my colleagues,
Right,
so I resonate the same kind of queries that they
right,
have.
right.
So, the question that I have from one of the parent
Yes,
says that in the current scenario, the question says like this, and I'm picking it up as it is.
yeah,
In the current scenario, the pandemic has a strange environment for children. It has created a strange environment for the children. They are unable to contemplate the reality. So
hmm.
they are feeling like prisoners. They are locked up inside homes, and even when they are wanting to go out, they are being forced to sit inside. So
Right.
how can parents make the kids understand the current reality? What do they say?
Okay. So the first and foremost is to understand what is the level of the child, at what level the child is able to understand what
uh,
is happening.
this child is 4.
Okay.
This
So
is a boy who's 4 years old.
okay, so let me just address it as a general issue instead of making it specific to a 4-year-old. But generally, say we have someone, a toddler within the ages of 2 to 4, right? That child will not be able to comprehend a lot of things that is happening versus say you have an 8, 9-year-old. So the information that
Yes.
you're giving to the child has to be at the level of the child, right? So there are certain essential things that the child needs to know, that there is a virus, that it is a dangerous situation. So going out becomes dangerous in the sense that the virus can cause an illness which is long term, which is long term in the sense of the effects that is happening, the time it takes for the symptoms to reduce, the intensity of the symptoms. So as parents, I think the thing that I want to tell parents is that you know what needs to be done. You don't have to second guess yourself. You know, you're the ones who know the kids better than, say, teachers or professionals out there, right? You know your children better. So you use a lot of these visual aids and, play material to sort of engage the child to help them understand what is happening, right? So a 2-year-old or a 4-year-old understands the concept of a fever, right? So just using that to explain to them that, when you have a fever, you don't want to go out and play. Similarly, this is a situation where you can get the virus if you go out, right? Including cues to sort of encourage hand washing or taking of precautions or wearing of masks.
Exactly.
And we have so much resources available right now online. So there's YouTube, you can Google search. There's a lot of materials that is there where you can engage the child. So you can probably, get these cut out of the virus and hand washing and help the child color. And through the process of coloring, help the child understand about the current situation instead of it being like a conversation with the child.
Because I think conversation with a 5-year-old, 4-year-old will probably not work.
Right.
They're going to listen from this year and it's just going to go out from the other year.
Yes.
But don't you think, I just heard you, and I'm just reminded of the fact that many times I notice parents taking it so casually. Parents going out without masks, without washing their hands, and then they expect the child to be so, so disciplined and listening. Do you think that that's also somewhere it is affecting?
So what I tell all the clients, my parents that I see of the children is that you are a role model for your child, right? The child learns everything from you. So the way you behave in such a situation, the child is going to pick up on that. And children are very observant. We don't realize
Very
that, but
observant.
children are
Yes,
very observant. So they pick
they
up
are
on
very
it,
observant.
right?
Hey, do you feel, Ishita, do you feel that children learn more when they see kids doing the same thing? Because I personally feel, being a teacher, that when they see other children do
Right,
it, probably washing their hands, they
right,
inculcate that habit more.
right.
And here parents are at a loss, probably, because
Right.
children cannot see each other. So here probably they are at a loss.
So it is difficult, of course. Like you said, children do learn quicker when they see other children. So it's also the same with adults. I think we learn more quicker when we see someone around us doing a similar sort of a thing. That's how everyone learns, basically, right? So I think schools at this point of time, teachers at this point of time are trying their best to sort of involve the
Yeah.
children in live classes,
Yes.
sort of get them involved and try to understand, help them interact with each other. But I think as parents also making it fun, making it more
Yeah.
interactive with the child is going to be helpful. It also sort of eases out the stress for the parent.
Right. Right. My second question, roots from here, and it
Right.
says it. I'll set a background to it. A lot of parents are resorting to the easier method, the easier way out. When the child is crying, you take them out.
Hmm.
They are complying to their whims and fancies,
Hmm.
and they're taking them out. So do you think that is appropriate? I see lots and lots of children out there in the park, and I really feel that this conversation that we're having today, I think even if 100 200 people are seeing it, at least they should understand the grave situation we are in. And if you're letting your child be out there playing, and many a times the mask is not there,
Hmm.
so is that the right way to deal with a cranky child? Do you think that?
So again, parents know your child the best. You also know how to deal with a cranky child the best, right? Sometimes I do agree that giving in is the easier way. It just, and with the current situation where everything is so stressful that you have parents who are working and managing the household at the same time, it becomes difficult. Understood, we understand. But what I would say as a professional in this sense is that if you are taking the necessary precautions, right? It's a call, it's an individualized call. There is no right
Yeah.
way or wrong way of parenting.
Yeah.
No one fix.
Yeah.
But
Right.
understand, evaluates the situation before you're risking a child. Right? The child does
Exactly.
not understand things at the level you as a parent or you as a family member understand. Right? If you feel you're taking all the right precautions, like you said, if the child is wearing a mask and goes out to play for a while and comes back home and washes hands, takes a shower, all of that is done. It is okay for the child to also go out because that child also needs that sort of a structure, right?
Yes.
But giving in, I would also say on the other end that giving in to all the whims and fancies and all the wishes of the child is also not a good idea, because then the child is expecting that from you even once the pandemic is
Every
over
time.
and things normalize.
It's over. Every time.
Yeah,
Every time.
yeah,
Probably you're raising the bar too much. You're
right,
raising the bar too high.
yeah,
What I have noticed with Tia also, and also I think a lot of mothers have, when we talk, we've noticed, that there's a lot of aggression that has suddenly got into this.
hmm.
I don't know how it is. How is a 2-year-old child, which I've been specified in the question, that
Yes,
this is a 2-year-old child and has become very very aggressive,
right,
throwing things, trampling upon food, and which the child wasn't like that. Now I don't know how to how to deal with that situation. Even I do see my daughter also, many times becoming very aggressive, sometimes shouting, and I think that's one way of releasing her pent up energy.
right.
That's what I'm assuming. I don't know how a parent should behave in that way when a child is going absolutely crazy.
So here's the thing. If you look at us adults, we are also feeling restricted. We are also getting irritable, annoyed a little more frequently than we usually would. Right. Now, for a
Yes.
child, there is a complete disruption of a routine. Right. You said a
Right. Right.
four-year-old child. A 4-year-old child is probably going to some form of school,
Def-
right? So there is some structure in the child's life which obviously has gotten disrupted right now. So the child
yes. Yes.
doesn't know how to express that. Anger is the easiest way for the child to express. So screaming, not wanting to eat, throwing things becomes the easiest way, right?
Hmm.
Of course, you don't want to facilitate it, you don't want to reinforce it, you don't want the child to continue it. But it is also important
Definitely.
as parents to sit down with the child and understand what is happening. So, understand why the child is feeling angry. Is it because that the child wants to go out and play? Or is it because the child, that some people have routines like on weekends we go out with our children, right? So,
Yeah.
that routine
Yeah.
also gets disrupted. So, understand where the child is coming from emotionally. Anger is the
Mhm.
easiest form of expressing an emotion.
I think we keep hearing that I mean, I think we have heard it when we were teenagers. I think now also teenagers are hearing that this generation has become really spoiled, and there's a lot of aggression. And so this is a question from one of my students, one of my student, and she says that ma'am, uh, I have become aggressive, and I know that, and I've become very violent.
Right,
How I should control it, I do not know. In fact, she has a younger sibling, and she has also learned the same behavior.
right,
Now, the parent is boggled at the situation that what am I supposed to do? Both of them are showing, their aggression at different levels,
right.
and each of them learning it
Okay.
from the other.
That's something which is very common with siblings. Like if one sibling picks something, the other one will automatically start to notice that, oh, my older sibling or my younger sibling is getting attention. So let me do the same to get attention. Right. So again,
Yes,
it
yes,
also becomes an easy way of getting attention. So if I scream, I notice everybody's coming and asking me what is wrong.
yes.
So of course it is a form of seeking attention, and like I mentioned, everybody's managing a lot more right now, being at home.
Right, right,
So
right.
as
So, like, what? Yeah,
yeah,
continue.
as adults also, you are stressed, and then you're not able to give the child as much time, and so the child learns that if I'm screaming, I get tired. Right? I think the best thing to do in such a situation is to sort of structure your routine in such a way that you have a specific time with the child so that the child
Right.
feels that connect with you and is not
I think it's
constantly
yeah, yeah.
seeking.
I think it's time we as parents, as whatever guardians or friend, we structure our routine.
Yes,
I think structuring of our routine is what is
yes.
required.
And by
And think
structuring, I don't mean that you have to have very fixed things, but at least find that one time space. So if you have a kid, spend time with the kid. If you have two kids, then make sure that individually you're spending some amount of time with each of them to
absolutely,
build that connection.
absolutely, absolutely. From I think we're discussing our discussion is pretty much relevant with the next question that I have from mother of Sayansh, and the child is 3.5 years old,
Right.
and they're actually siblings. Again, they are siblings. So one is 3.5, one is 5, and they say both the parents are working. Both of them are working, and both of them are working from home. So this is very interesting that the children are shouting. That's there. Of course, there's aggression. We can see that they're making up stories also to get attention. So probably there's a lot of falsehood lies being cooked up to gain attention. How as a parent I deal with it? That's what
Again,
the parent is asking.
understand what the child is wanting to communicate through that lie. So it's very simple. If I am feeling something, I will come up to you and say, Sulpi, this is what you said, and this is how you made me feel. A child cannot do that. The
Right.
child does not have the ability to do that. So, for the child, making up a story, because stories are something that I think all children love, story becomes a medium through which they are expressing what
Yes.
they want to, say. So, for parents, understand what the content of the
Right.
story is. That will give you a hint as to what the child is trying to say, right? Again, aggression is a form of attention seeking, so probably getting in a little specific one-on-one time with the children is going to help. I understand it does not have to be, hours together. Just say even half an hour, 45 minutes with one child where you're doing something that the child is enjoying with you. And it doesn't
I
have to
think
be learning
yeah.
oriented. It has to be play
Yeah.
interactive oriented for the child to just
Play.
enjoy.
Yes. Yeah. I think quality time is what you're referring to over here.
Absolutely.
Like even if it is half
Absolutely.
an hour or so, that parent actually sits and tries to understand that.
Right. So with
You know,
younger children,
the next
right, with older children,
yeah,
probably you can end up just sitting and watching something that the older child is watching. It's also,
screen.
yeah, because that's how they, spend their time. Also, with older children, you can find other sort of activities and games that can be done. So something like a Jenga can be played with a adolescent, right? Keeping them
Mm.
engaged,
Yes,
having a
yes.
conversation which is not related to studies or marks or how your friends do. It's a general conversation.
I think when the teenagers say,
Hmm.
and a lot of them, because I'm dealing with teenagers at
Right.
this moment being a teacher, so there seem to be a lot of frustration out there with respect to studies, and I think the reason why they're not sitting with their parents is because the topic ultimately revolves and comes down to marks and assignments and all of that.
I would tell parents that yes,
I
that
think
is a necessary conversation, but also find a time where you're not just talking about marks and studies and how the child is performing. There are other aspects that you can sort of talk to the child about.
right, right. So I have the next question. I think our discussion has led us to the right question. And it says this is a 15-year-old child. And the mom is saying that how do I channelize the energy of my son and make him sit and study?
Okay.
They cannot channelize the child. She says the child is jumping on sofas and beds and just cannot kind of contain himself. Now, I don't know how do I imagine a 15-year-old
Right.
jumping
Okay.
around the house.
Okay. So here's the thing. I think we've also become a little restless at home. Sitting in one place for us has also become a task. So we
Yes.
are also moving around a lot. Right. As a 15-year-old, there are a lot of things that the parents can do with the child. So something as simple as going on a drive with the child. So if the father takes the child for a drive or the mother takes the child for a drive, it becomes quality time that you're spending. Plus, it is a change of environment for the child. So the child is not restricted at home. You're not talking about academics. There is something
Yes.
alternative that you're doing, and the child is
Yes.
also enjoying it at the same time.
Yes.
I think in our sort of society, in our culture, we associate parents with marks and all the negative things as teenagers,
Yeah, it just happens. Yeah.
right? And I think there is a need to
Yes, it
change
does.
that,
It does
that
happen.
association basically. So, quality time can be anything that the child enjoys or the parent enjoys or a common thing that the two of you enjoy. Doesn't have to be, and of course it should not include marks and academics and behaviors and all of that.
Exactly. Exactly. And this brings us to it says the question says work from home is making the parents, they are uploading their stress on kids.
Yes.
Mother of a 4-year has become too short tempered, and also some of them did not write it down to me, but then they told me verbally
Hmm.
that they are giving one or two small
Right, right, right. As a part of
one
frustration
tight
release.
one onto the on both the cheeks. And it's not only mothers, but these are fathers also. So I'm appalled because somewhere we are really putting our stress on them.
Hmm.
I mean, both of us are also working, but I think somewhere there's a check that we need to put on our
Right,
behavior as well.
right. And for this check, you need time for yourself. So you need to find time to
Hmm.
do what you enjoy as a parent. So a lot of times what happens is once you become parents, you lose yourself. You stop doing things
Yeah.
you enjoy. Right. And
Right.
initially you did those things because it sort of relaxed you, brought in that sense of calm and rejuvenation which everyone requires. Right. So I think
And isn't yeah, please go ahead. Go ahead.
so I think finding that little time through the week. So even if you're not doing it every day, but say during the weekends, finding that 1 hour and just doing what you like is also helping you relax so that you don't take it out on the child.
And I was surprised as to
Yeah.
all questions that were sent to me.
Hmm.
All these questions were by women,
Right.
mothers.
Right.
I don't understand why. What you're a psychologist,
Right.
you'll be able to throw some light. There's something that just struck my mind that every question,
Hmm.
many of them I couldn't structure, but yeah, while those through my conversations, I think they'll be able to get it. Uh, you're throwing light on a lot of other things. So why do you think only mothers would be asking questions? Why? Why is it? I mean, cannot be coincidence.
I
I put that out for everybody. Why would I only
think
get mothers?
so. What I understand is, I think a lot of our idea of parenting as a society is mother focused. It's not really both parents equally
Yes.
involved. It is
Absolutely.
it's more the mother is being involved, and so the mother shows concern. I am pretty sure fathers out there are also concerned, but they are just not vocalizing it, which is another aspect of our society that men are not supposed to vocalize a lot of things, a lot of emotions that they are going through, which
Yeah.
is not considered appropriate for them. So I think that is wherein the more frustration is also coming in. So the vocalization bit, mothers are seeing, women are seeing as being more vocal, are seen as being more involved, and so the concern comes from them. But I'm pretty sure
And
equal concern is present on the
definitely. Definitely. I was a little, I was a little curious to know.
right.
Do you feel? I mean, I do feel that when we are not vocal, really, as fathers, if you're not vocal, as you grow, as your child grows into a teenager and then to an adult, somewhere if you're not vocal with your child from the very beginning,
Right.
somewhere the bond kind of becomes a little, it kinds of become a little, I don't know what's the right word for it, but
Hmm.
somewhere you don't have that communication, that a
Yeah,
strong sense of
I
yeah.
think it's very important from a very young age to try and communicate with the child about emotions, right? So when, like you said, there are a lot of questions you got about 3-year-old, 5-year-old showing aggression, right? Stomping their feet, throwing things away,
Yes,
screaming,
yes, yes.
right? Of course, you don't want to reinforce the behavior, but you also want to understand and validate
Understand.
how the child
Exactly.
is feeling. So feeling angry is okay. Feeling angry is a natural thing. But what I'm doing in anger is not acceptable. That distinction needs to come from the parents. And that will only come when you spend time with the child and try to understand where the child is coming. So I think emotional communication is something that needs to begin at a very young age for the child to understand that it's okay for me to be angry, but I cannot behave in this way if I'm angry. And I think something that's very lacking in our society.
Exactly. Ishita, these are some questions that I have just now, some of the kids were talking.
Hmm.
They say that, sometimes aggression is leading to actions that are not acceptable.
Right,
And this is being done by young like teenagers.
right, right.
Sometimes banging the door, and sometimes just not listening, just banging the door and throwing things off. I think we can accept the behavior if the child is young, but I mean, how do you?
So with teenagers, what happens is you've reached the stage where you've not had that conversation with your parents over a long period of time. So that trust, that bond emotionally with the parents to develop at that stage becomes a little risky. So if I'm angry, I would rather bang the door than sit down and explain to my parents why I'm angry, right? So with teenagers, I would say finding that one person who with whom they are able to talk, share, whether it's a teacher, whether it's a school counselor, whether it's an older sibling, an older cousin, anybody, that one person who acknowledges how you're feeling, but also helps you deal with that emotion in a different way becomes essential. It could also be a parent. I know a
Right.
lot of teenagers are
Exactly.
close to their parents, can have communication with their parents. So find that one person you're comfortable with and have that conversation and try to understand why you're feeling this way.
Right. Right. I think we'll be catching up once again because uh, I think the teenage segment, it's I think it's a very tumultuous phase,
Yes,
and
and
it
we can go
needs a
on about
complete.
it.
Yeah. So I think I'm glad that you could join me, and I think those who are going to listen to whatever we have talked about, I think they get something out of it.
I
And Ishita, I really thank you for sparing this time. And I think YouTube has also been a medium through which we've been able to see each other. Probably we are communicating after a long, long time, but I'm glad we could spare this time. And it's I think it's a good cause, and I'm sure it will help a lot of parents. Your last words, your closing kind of words for this particular session. There are more to come. Not going to leave you. I'll pull you in for a lot of other sensitive topics now this time now.
will be willing for that. I think the last thing that I want to say is to sort of spend time with your kids, whether just the quality time, however, how much ever, but just spend a little quality time with your kids and also spend some time for yourself in your self care. So I think both these things have become very essential right now in this.
And if I tell you an observation, I see now, since everybody is at home,
Yeah,
people are going absolutely crazy to get certificates, accumulate, kind of certificates, do this training, do that training. I personally feel this is a very valuable time, and you should spend it with your kids. But I really do see a lot of mothers, lot of they're just running after trainings and certificates and workshops. Now, I somewhere feel that it's like a race that everybody is running in.
absolutely. I think there's a lot of pressure from social media where people are, trying and discovering new
Yeah.
using this time to sort of gain certificates and workshops and things like that. I mean, yes, of course, that's necessary, that's important. Yes, you should do that. But I think also taking that time for yourself and your family and your child is equally important.
I think somewhere we need to stop running in the rat race. I mean, it's time we just pause and breathe also for a while.
It is very necessary that we pause and breathe, especially in such uncertain times. It's very
Uncertain time.
yes.
Exactly. So nice talking to you, Ishita. I am looking forward
So
to
much
seeing
fun.
you more often on the channel now. Okay.
Yes.
So thank you, Ishita,